Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about week 28 of your pregnancy. So if you didn't already know, you're officially in your third trimester when you're in week 28, so welcome to your third trimester if that's you. Some signs and symptoms, nothing really going on with mom as far as this week goes. Something your OB might recommend is you starting to count your baby's kicking. Not all OBs recommend this. Most of the time they'll just recommend that you feel some sort of movement throughout the day, just to make sure that baby's still mobile in there. Another thing that baby might be doing is they might be starting to head to that head down position. So if you didn't already know, head down is how you want baby to be positioned in order to give birth vaginally. If they don't end up going head down, that's what's considered breech, and they might recommend a C-section, or they might recommend you come in here so we can work with that as well. So what's happening with baby this week? So their eyelashes are continuing to grow, so they're getting longer. If you put a light up to your belly, that will start to blink as in response to the light. And they have new nerve cells that are being added to their brain, and most of these are going to their different senses. So they're learning to connect their eyes, their ears, smelling, like all of that together to their brain. This week, baby is the size of an eggplant, which is roughly 14 3/4 inches long, and they're weighing about 2 1/4 pounds. So they're slowly but surely getting bigger each week. So if you have any questions about this or anything about your third trimester, go ahead and give us a call here at the office. Thank you. Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about pregnancy week 29. So some new signs and symptoms that you might be having. You might be having some shortness of breath. I'm actually experiencing this right now. So this is because when your baby starts to go head down, they're going to start to kick on your diaphragm instead of your lower pelvis, which is going to push on your lungs, causing you to be a little bit shorter of breath. You might also notice some hemorrhoids forming. So this is very, very common in this stage, mainly because your placenta is starting to grow more and more, and it's going to put a lot of pressure on your different organs as far as the blood vessels, so it can cause some hemorrhoids. So what's happening with baby this week? So with baby, their head is starting to expand more, and this is because their brain is continuing to grow, so their head must expand in order for their brain to grow. Their taste buds are starting to transmit more nerves and receptors to the brain, and their bones are going to continue to harden, which this is going to continue on for quite a while still. This week, baby is the size of a butternut squash, which is roughly about 15 inches long, and they're weighing about 2 1/2 pounds. Now, as far as being in your third trimester, as far as when you come in to see me, this is when things pick up a little bit. So like I said before, your first and second trimester, if you're coming to see me, if you're in no pain whatsoever and you just want to be treated for your pregnancy, we typically follow your OB schedule, which is about once a month through your first 2 trimesters. Now that we're starting to get into your third trimester and getting closer to your due date, we're actually going to increase that frequency. A lot of the reasons is because, especially your last month and a half, your belly's going to pop out more, baby's going to drop into your pelvis. A lot of big changes are happening in a short amount of time, and a lot of our natural body's responses are going to be to tighten up to protect it. So this is when we actually want everything to be looser, so when it comes time for labor, everything opens nicely. So that's why we kind of increase your frequency the closer we get to your due date. So if you have any questions about this, anything about prenatal care, as far as just regular prenatal care or pain care, give us a call here at the office. Thank you. Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about week 30 of pregnancy. So some new signs and symptoms that you might be having. You might be noticing that your ligaments in your pelvis are loosening. So you might not actually notice that the actual ligaments are loosening, but you might notice like an increase in pain, an increase in clumsiness. So these are signs that your ligaments are starting to loosen, and this is because of a hormone called relaxin that's starting to pump more and more throughout our body, preparing our pelvis for birth. So this is something that we see commonly here, we can help with, whether it's help adjusting the tight joints and tight ligaments and loosening the tight ones, or helping kind of stabilize these loose ones. So we do this through a lot of things, especially taping is actually very, very beneficial. Another thing you might notice is your fatigue starting to come back. So you notice second trimester, you kind of had that energy spurt, and then now that we're in our third, our fatigue's gonna slowly come back. Another thing you might notice is your feet can actually grow in size. So again, this is similar to the first one, so your ligaments are getting looser, so your bones are kind of moving apart more, so your feet actually might grow in shoe size. Not uncommon, and it's also not uncommon to keep this increased shoe size after baby's born, so you might have to replace all your shoes as well. Another thing you might notice is your mood swings might be back. Not uncommon again. What you want to look out for, not so much that your anxiety might be high about delivery, your anxiety might be high about becoming a first-time parent or just taking care of a child, but you do want to look out for kind of those baby blues, because you can start having some early signs of postpartum depression now that might affect you after baby's born. So if you do have kind of some of these more postpartum signs that are starting to show up, definitely talk to your OB. Now, what's happening with baby this week? So last week we talked about how babies are blinking more and responding more to light. So now they're actually turning their entire head to the light. So if baby's facing forward and you happen to shine a light on the side of your belly, they'll actually turn their entire head to go towards that light. Their skin cells are also starting to make pigment. So this is what's actually going to make their skin the color that it actually is going to be when they're born. And lastly, you should notice lots and lots of movement. So those small kicks that you just felt a little bit should now be getting a lot more frequent. You can feel them kind of rolling around in there sometimes. And I've been feeling that a lot. She's less mobile during the day, but at nighttime or right away in the morning, she's very mobile. She kicks a lot. So I feel her, and you can actually see my belly kind of pop sometimes because she's kicking so much. This week, baby is the size of a large cabbage, which is roughly 15 3/4 inches long, and she's actually 3 pounds now, or he if it's a boy. But they're starting to grow more and more, and we're getting closer and closer to our due date. So they're starting to grow more and more, and they're getting closer to that size that they're going to be when they're born. So if you have any questions regarding this, especially with, like I talked about, the loose ligaments and how we can help with that, give our office a call. Thank you. Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about week 31 of pregnancy. So some new signs and symptoms that you might be noticing. First, our Braxton Hicks contractions can start at any time now. So what you want to pay attention to is when they start to get a little bit more regular and a little bit more like kind of same timeline spaced out. That's when they're getting into more regular contractions, and you should definitely contact your OB. Braxton Hicks are going to be a little more irregular, so you might have one, 5 minutes later have another, but not have another one again for an hour after that. So those are regular ones or more Braxton Hicks. You might also notice you have a little bit of constipation, and what this is from is the more that our belly grows, the more that your baby's going to kind of push on your rectum and intestines, and might cause a little constipation there. So what's happening with baby this week? So this week, your baby's eyes are continuing to adapt and grow and learn new things, so baby's able to slowly start to make out kind of different shapes, different sizes of things. Still obviously very blurry to them, but they're able to differentiate a little bit more. You'll also notice your baby is starting to get a little bit fatter, so they're starting to get more fat buildup under their skin, so they're going to get heavier and heavier. And lastly, a growth spurt is on its way, so you might notice a little bit more of cramping sensation, kind of like early in your pregnancy when your uterus was starting to grow more and more, and that's just because baby's hitting a growth spurt soon. And this week, baby's the size of roughly a coconut, which is about 16 1/4 inches long and about 3 1/4 pounds. So baby's starting to grow more and more, and we're getting closer and closer to your due date. So if you have any questions about this or anything about prenatal care, give our office a call. Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about week 32 of pregnancy. So some new signs and symptoms you might be having. You might notice that your center of gravity is off as your belly starts to grow. As your belly starts to pop out, naturally your upper back's going to lean backwards to kind of keep your center of gravity a little bit more in the middle, and so this might actually start to cause some lower back pain. What you might also notice is a little bit more shortness of breath. So as we've talked about previously, with the baby, our blood volume has increased quite a bit, so our body's working a lot harder, and as well as the baby's going to start pushing up on your diaphragm as the uterus grows up a lot more, so it can cause you to be a little bit more short of breath. Now at this point, you're gaining about 1 pound per week, but half of that pound is actually going to be going to your baby, and the other half is actually only going to be going to you. So while it might seem like a lot, you're only actually gaining half of the pound while your baby's gaining the rest. So what's happening with baby this week? So baby is getting ready to hit their last growth spurt before they're born, so you might notice some cramping, some tension, your belly popping more as the baby is going through this last growth spurt. Their fingernails are starting to form and are going to continue to grow throughout pregnancy. And lastly, their hair color and their hair texture is now visible. So whether they're going to be blonde, brunette, redhead, it's able to be determined now. This week, baby is the size of a himica, which is about 18 3/4 inches long, and they're about 3 3/4 pounds. So like I said, they're going to start to grow a lot more in these next couple weeks. So don't be surprised if you have a little cramping, start to pop out more. It's very common at this point in time. So if you have any questions about this or any questions about your pregnancy, give us a call at the office. Thank you. Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about week 33 of pregnancy. So some new signs and symptoms you might be having is you might notice that you have to use the restroom more. As baby starts to kind of drop into the pelvis and get a little bit lower, they could compress on your bladder, which makes you have to go to the bathroom even more. I do this all the time, but I have been for quite a while now. Another sign and symptom that you might be having is some numbness and tingling in the hands and fingers. So automatically a lot of people go to carpal tunnel with this, but there's a lot of areas in your body that the nerves that go to your hands and fingers could be compressed. So this is something we see commonly here that we definitely want to take a look at. So if you're having these symptoms, let your chiropractor know. So what's going on with baby this week? So baby's skull is continuing to form, although it is staying more flexible. This is for a couple of reasons. A, as the brain is starting to grow and take up more space, the skull wants to be flexible to be able to handle that growth. And at the same time, it wants to continue to be flexible so when it comes time for birth and the baby goes through the canal, that skull is actually going to compress a little bit so that the baby can go through the canal a lot easier. Another thing that's happening is originally baby was kind of wrinkly and not a lot of fat under their skin, and last week we talked about how that fat's starting to grow under their skin, so the skin is actually starting to smooth out this week, so they're getting less and less wrinkly. And this week baby is actually the size of a pineapple, so they're roughly 17 1/4 inches long and about 4 1/3 pounds. So like I said, they're hitting this growth spurt, so they're starting to get bigger and bigger each week. So if you have any questions about this, about pregnancy, labor, anything we can do to help, give our office a call. Thank you. Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about week 34 of pregnancy. So some new signs and symptoms you might be having. You might notice some dizziness kind of with changing positions, whether it's going from seated to standing or lying to standing. This is because a lot of the times your feet are starting to swell, so blood's kind of pulling in your extremities. So that kind of change in pressure between where your blood's at can cause you to get a little bit dizzy. Another thing you might notice is some itchiness around the belly. As we've talked about before, baby's starting to grow quite a bit now. So as baby grows, your belly grows. So that kind of stretching of your belly can cause a lot of itchiness in that area. You might also notice that you're having a harder time sleeping. So this could be for a couple of reasons. One, probably getting up more frequently now to use the restroom. I'm probably up at least 3 or 4 times a night. You might also notice that it's harder to get comfortable sleeping now. So this is where we can talk about different sleep positions, different pillows to use, kind of how to make your body more comfortable at night so you're able to sleep more. So you might also notice some fatigue due to this lack of sleep. So what's happening with baby this week? So baby's hearing is slowly starting to get more and more fine-tuned. So you might notice that they're recognizing voices a little bit more. So for instance, if your husband, your spouse, someone is talking, you might notice baby likes their voice, so baby's more active whenever they're speaking to them. Their body's starting to get fatter and fatter, and so this is helping whenever they're born, so their temperatures are regulated a little bit more with that fat. And this is around the time that if baby's actually born, they have a higher chance of surviving because they'll still probably go to the NICU. They're a lot more developed at this point in time. And this week, baby is the size of a cantaloupe. So they're roughly about 17 3/4 inches long and about 4 3/4 pounds. So each week they're starting to grow more and more. So if you have any questions about baby or how we can help with you, how we can help with baby, give our office a call. Thank you. Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about week 35 of pregnancy. So some new signs and symptoms you might be having. You might notice you're a little shorter of breath or having some heartburn. So at this point in time, your uterus is actually expanding up into your rib cage. So it's putting a lot more pressure on your diaphragm, which can put more pressure on your stomach, which can cause some heartburn. Obviously, when putting pressure on your diaphragm, it's going to push on your lungs, causing some shortness of breath. If you can't notice, I'm having a lot of that now because my baby is so high up in my ribs and she kicks up there a lot. I do get short of breath fairly easily at this point. Another thing you might start to notice is you might be getting a little bit more clumsy. This is also for a couple of reasons. One, you'll notice your belly starting to pop out a lot more, so your center of gravity is off. So as your body kind of starts to compensate for that by leaning back, you might notice yourself a little bit more clumsy, especially going forward because of all the excess weight on the front of your stomach. Another reason you might be clumsy is because the hormone relaxin's pumping through your body and getting more and more, and this is going to help you eventually when it comes to labor and delivery. But what relaxin does is it actually makes your ligaments more lax in your body. So the fact that your ligaments are more lax at this point, your joints are moving a lot more, so your body's not used to it, so you can get a little bit more clumsy because of this as well. Now the fact that your ligaments are more lax is something we can address here, so we can address even if they're stiff or lax, and kind of give you some stuff to do at home to help with that. So what's happening with baby this week? So this week baby's starting to gain more and more weight, so they're roughly gaining about 5 ounces a week at this point. So you might notice again that you're starting to pop out more as baby's getting bigger and bigger. So this week, baby is the size of roughly a honeydew melon, which is about 18¼ inches long and about 5¼ pounds. So like I said, each time they're kind of gaining a little bit more and growing in length. So this can cause a lot of stress on your body. So if you have any questions regarding this or how I can help, give our office a call. Thank you. Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about week 36 of pregnancy. So some new signs and symptoms you might be having. If baby's still kind of up more in your ribcage area, you might notice still some difficulty breathing or a decrease in appetite as the baby's up pushing against your stomach and lungs and causing all that increased pressure. You might notice a little bit of difference there. Now, this is about the time where baby actually starts to drop into the pelvis, so you might notice the opposite effect. You might notice that you're actually breathing a little bit easier because baby is taking that pressure off of your lungs. You might also notice some pressure or some lightening sensations in the pelvic region. This is normal, and this is just baby's head dropping down there and getting a little bit more fullness in the pelvis, so you might notice some pressure down there. So what's happening with baby this week? So at this point, baby should be head down. If they're not, they are considered breech, and that's something that we actually treat here. So it's something you can come in, we can work on you. Now, we don't actually treat the breech baby. Instead, we're going to treat your body, get it in position, get it is kind of the optimal function for everything to open nicely so baby has enough room to want to go head down. Baby's toenails are also starting to grow slowly but surely, and at this point they're gaining even more weight, so they're roughly gaining about an ounce a day. This week baby is about 5¾ pounds and about 18¾ inches long, which is roughly about the size of a head of romaine lettuce. So if you have any questions about this or any questions about your pregnancy, give our office a call. Thank you. Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about week 37 of pregnancy. So some new signs and symptoms you might be having. If you've been having Braxton Hicks contractions, they might be getting a little bit more frequent and a little more intense as your body's preparing for birth and labor. You might also notice some vaginal discharge. So the thing with vaginal discharge, you want to kind of be prepared for it. You might notice a little bit of blood. So if there's just a little bit, that's okay. That typically means that birth is only a few days away. If it gets a little bit more than just a small amount of blood, this is the time you definitely need to call your OB and let them know what's going on. Now, what's going on with baby this week? Now with baby, between now and birth, their brain is going to grow about 1/3 of its size in this short period of time. They're also able to smile in birth, so they might not smile, but their facial muscles are starting to work a little bit more, so they're able to smile. They're still not technically full term. They still have until week 39 until they're considered full term. And this is because their lungs, their liver, their eyes, and their ears still have a little bit of developmental things that they have to go through. So they're still not considered full term until a couple more weeks. And this week, baby is roughly about 6¼ pounds and about 19¼ inches long, which is roughly about the size of a Swiss chard. So if you have any questions about this, any questions about your pregnancy, labor, delivery, baby, anything like that in general, give our office a call. Thank you. Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about week 38 of pregnancy. So some new signs and symptoms you might be experiencing. You might notice a little bit more swelling in your ankles, feet, and hands. So this is perfectly normal typically. What you do want to look out for is excess swelling. So if you notice that your feet and ankles and even your hands are swollen a little bit more than you would think, or even if you notice any swelling at all on your face, these are signs of preeclampsia and definitely something you need to contact your OB about. Another new sign and symptom you might be having is a little bit of difficulty sleeping. Now you might be having trouble sleeping for a couple different reasons. One of the most common is you just can't get comfortable at this point in time. Whether it's you're in pain, you can't get in a comfortable position to sleep, up every 30 minutes to go to the bathroom. There's a lot of reasons why you can't get comfortable enough to get a good night's sleep. Another common reason is actually because of crazy dreams you might be having. And they're saying a lot of the times these crazy dreams are actually stemming from anxiety. So anxiety from the upcoming birth, upcoming labor, upcoming of the fact that you're about to have a tiny human that you have to raise. So a lot of these times, these are kind of common to have. So don't get freaked out if you're having those crazy dreams. They're very common and most likely anxiety based. What's going on with baby this week? This week, not much is changing with baby. They're still growing each week, developing more and more. The big difference is their grips are actually getting very, very strong and firm. So when they come out of the womb, you notice that whenever they grip, typically people put their fingers in their hands to check on their grip. And this is where it's starting to get more and more strong. And this week, baby is about the size of a leek, which is roughly about 18.5 inches and 6 3/4 pounds. So like I said, they keep growing more and more each week. So this is where you're gonna notice that your belly's gonna pop a lot more. Baby's gonna start to drop into the pelvis like we talked about last week, as far as pressure down there. So the bigger the baby, the more pressure and everything you're gonna feel. So if you have any questions about this or anything regarding your pregnancy, give our office a call. Thank you. Hi guys, Dr. Mandi here from Drummond Chiropractic, and this week we're going to talk about week 39 of pregnancy. So some new signs and symptoms you might be having are all kind of associated with actually going into labor. So at this point you might notice that your water actually breaks. So what it's going to happen is you're just going to feel this kind of rush of liquids. Can be a lot, can be a little, depends on the person, and these are signs that you're actually going into labor. Another thing that you might notice, your OB might start to do kind of cervical exams. So what they're checking for are you dilated at all, or are you effacing? So what effacing is where your cervix is actually thinning out. So typically they give you about a percentage, whether it's 10%, 30%. The closer you get to 100, the thinner your cervix is. So the more prepared you are and the more things are closer to going into labor. So you might notice that at this point your OB might be checking those things to see how close you are to going into labor. So what's happening with baby this week? Technically this week baby is considered a full-term baby, so if birth happens, everything's great with baby. A lot of people tend to think that after 36 weeks baby is considered full-term, because if at that point you go into labor, they're not going to stop labor, where baby isn't considered full-term until actually 39 weeks. So like I said, at this point they're actually considered full-term, and if delivery happens again, that's great at this point in time. Another thing is that their fingernails are all the way fully formed, so whenever they come out of the womb, you'll notice that they have nice little baby fingertips. Another new thing that's happening is that they're forming new skin cells. So like an adult or like a child, our skin cells kind of let go and slough off little by little, and new skin cells come behind and form. So that's what's happening with the baby right now, is they're forming new skin cells. So this week, baby is roughly the size of a mini watermelon. So they're about 20 inches long and about 7 1/4 pounds. So if you have any questions about this, about labor, delivery, about how we can treat the baby after he's born, or she, give our office a call. Thank you.